guys, welcome to my SI session. Today we're going to be learning about chlamydia and gonorrhea, which are both sexually transmitted bacterial infections. Just to give you a little overview of the symptoms that you might see in these infections, you're going to have minimal to no symptoms in both of them. You might see urinary frequency, dysuria, possibly some postcoital bleeding. You might have tenderness in the cervix or lower abdominal pain with both of them. The only difference for gonorrhea is that you might see yellow or green, maybe foul-smelling discharge. You're going to see the cervical tenderness as well, and it might become inflamed and appear eroded, and you might have some pain in the genital area.
For chlamydia and gonorrhea, it's acquired through anal, vaginal, and oral sex, and you can also become infected with secretions or fluids.
Okay, and do you have any teaching points on how to prevent these diseases?
Yes, you can get yearly testing, which is recommended, and the CDC suggests that all pregnant women be tested at the first prenatal appointment. If left untreated, women can get pelvic inflammatory disease and become...
Okay, so can anyone tell me if these can be transferred to the fetus or the neonate? Yes, Courtney?
Both chlamydia and gonorrhea can be transferred to the fetus during the passage through the birth canal. As a precaution, at birth, all newborns should receive eye prophylaxis. Generally, it's erythromycin ophthalmic ointment.
Okay, next, can anyone tell me what medications you would use to treat gonorrhea and chlamydia? Dan?
Okay, so I know that for gonorrhea, the treatment is going to be the same for both pregnant and non-pregnant people, and you're going to want to give a single dose of ceftriaxone, and also it's going to be a dual treatment because people usually get both gonorrhea and chlamydia together, and also both sexual partners are going to want to be treated. For chlamydia, the treatment that's recommended is going to be a single dose of azithromycin orally or doxycycline, and both sexual partners should be treated, and couples should abstain from any intercourse for 7 days. And also the CDC does recommend that pregnant women be treated with azithromycin or amoxicillin because doxycycline is contraindicated in pregnancy.
Okay guys, so y'all did really great. I'm just going to give y'all a few teaching points that you might see on your exam. The first one is just to use protection with every partner, every time, if you are choosing to have sexual intercourse, and if not, abstinence is also a great way to prevent getting these infections. Another thing to keep in mind is that if a test comes back positive, all sexual partners need to be treated and should finish all medication that is prescribed. They do recommend annual screenings for women. And also just remember to educate your patients that the medication used to treat these infections may decrease the effectiveness of any oral contraceptions that they may be taking, so be sure to use extra protection. One other thing is that retesting is recommended 3 months after treatment for reinforcement for gonorrhea specifically. And last but not least, another great thing to keep in mind for your patients is that they should limit the number of their sexual partners or practice monogamy just to decrease their chances of getting this infection. So that's going to conclude our SI session today. Does anyone have any questions?
No.
All right, well, good luck on your exam.
Thank you.
I feel ready for the test.
Me too.